Thinking about piercing your child's ears? Here's an A to Z guide on what to expect, what you should look for in a piercer, and why the decision to pierce baby's ears is not anyone's business but your own. Piercing baby's ears at birth. Is it advisable? A baby's ears are pierced at birth for several reasons, such as to adhere to trends or cultural reasons. However, if your baby's health is normal and there are no complications, you can discuss with your doctor about piercing your baby's ears at birth. When is it safe to pierce baby's ears? Experts may suggest that you wait for at least 6 months to pierce your baby's ears. Well, whenever you puncture your baby's ears, there is a potential risk of infection. Because your baby's immune system is still developing, it will be a good idea to wait a little longer. Who should pierce your baby's ears? Traditionally, parents get their baby's ears pierced by a local vendor or a family jeweler. You can also ask your child's pediatrician or dermatologist to pierce your child's ears. It is best to get your baby's ears pierced from a hygienic place such as doctor's clinic, a body piercing parlor, or an expert. How to choose the right earrings? Back in the day, people inserted neem twigs into the pierced ears of the baby because of its disinfectant properties. Choosing the right kind of earring for your baby is very important. Make sure that the earring you choose for your baby is small, flat, and round. The earring should not have any sharp edges and the fastener should cover the back part of the earring. It is recommended that you do not choose dangling earrings for your baby. How to prepare yourself for piercing her ears? The first and foremost thing you need to consider is your baby's health. It is essential that your baby is in the pink of health when you get the piercing done. You can even get a nod from your doctor before going for it. Your doctor will most likely apply numbing ointment around the baby's earlobes and may also prescribe some painkillers to ease the pain. How to prepare your baby? Dress your baby in comfortable clothes, preferably in a button-down dress, which would be easier for you to change without hurting your baby's ears. You may carry your baby's favorite toy to distract her. If your baby is old enough for solid food, carry her favorite snack to treat her after the piercing is done. Is ear piercing painful? Generally, there are two techniques used for piercing: needle and piercing gun. The pain from the needle will be more like getting an injection, and the piercing gun will feel like a stapler pin going through the skin. But both these methods will cause pain to your baby. Needle versus gun. And now, the decision is yours. Some of the complications may arise because of ear piercing, such as infection. Your baby may develop a piercing infection if the equipment has not been sterilized, the earring clasp is too tight, or the earring is dirty. Formation of keloid. Your baby's body tends to heal itself from the piercing trauma, but sometimes it tends to overheal itself, resulting in substantial scar tissues called keloids. Keloids often require medical or surgical intervention. Allergic reactions. Your baby may have an allergic reaction from the metal used in the earring. It is suggested to use gold, silver, or surgical steel metal for your baby's earrings. And earrings made from other metals such as nickel may cause infection. Choking hazards. It is imperative that you choose earrings that do not come off easily. Your baby is susceptible to choking hazards because of loose earrings. The small parts of the earring may also fall inside your baby's ears and cause complications. Tearing. If your baby is donning hooped or dangling earrings, there is a possibility that your baby may pull it out or it may stick onto something your baby may be playing with. This situation may lead to the tearing of your baby's earlobes. Post-care tips. It is advised not to change or remove your baby's earrings for at least for 6 weeks after the ear piercing procedure. In case you notice any pus, swelling or fever, you should get immediate medical help as it could be because of an infection. Avoid swimming pools, tubs, lakes or other water bodies after getting your baby's ears pierced. The impurity of the water may cause an infection in your baby's earlobes. Always wash your hands with soap and warm water before touching your baby's piercing. I hope this video is useful. Please share this video to new parents to make sure the baby is safe and sound after it happens. Bye bye. See you in next one.